Cancer causes more death than malaria, HIV and TB combined globally. Lower and middle-income countries like Kenya bear 70% of this global burden, and the problem is punctuated by high cost of cancer diagnosis and treatment. A report released in July 2022 by the National Cancer Taskforce indicates that cancer is the third leading cause of death in Kenya and the second leading cause of non-communicable diseases after cardiovascular diseases. GlobalCan, an online database providing global cancer statistics, shows an exponential increase in cancer cases in Kenya. For instance, 47,887 cases were diagnosed in 2018 and 42,116 in 2020. Annual mortality was 32,987 in 2018 and 27,092 in 2020. The report further reveals that the risk of developing cancer before the age of 75 years in Kenya is 18% among women and 14.3% among men, with both genders being 16.2%. Similarly, 12.7% of women were likely to die from cancer before the age of 75, compared to 10.3% of men, with the risk of both sexes being 11.6%. There are multiple types of cancer, but Dr. Sarah Obuya, a clinical oncologist with the Moi Teaching and Referral Hospital, lists at least 5 major ones in Kenya at the moment.
We have the big 5, which is breast, lung, cervix, and GI cancers. Not in particular order, but now in our country, if you are a woman, most likely you'll have breast cancer, followed by cervical cancer, and then esophageal cancer. If you are a male, most likely you will get cancer of the prostate.
Breast cancer is the most prevalent type of cancer among women in Kenya, followed by cervical cancer. At least 34 out of every 100,000 women are diagnosed with breast cancer, while it's 9 for every 100,000 for cervical cancer. Dr. Obuya corroborates this data.
Cancer of the breast most likely is a genetically inherited condition. You have mutations in your genes that are passed down generations, either from your grandmother to your mother, and then to yourself, and you are also able to pass it to your generation. This kind of ladies tend to get cancer of the breast when they are young. Their cancers are very aggressive and they poorly respond to treatment. They are also predisposed to getting cancer of the ovary.
Nathaniel Mwadime, a doctor at Top Hill Hospital in Eldoret, says certain types of cancer may manifest exclusively in a specific gender, while others affect both male and female.
Breast cancer is more common in women than it is in men. And cervical cancer is exclusively for women. So you have lesser incidences of breast cancer in men than in women. So that figure gets skewed because of the numbers, the population that is there. So there's a higher predisposition to getting breast cancer in women than it is in men.
Data from the Ministry of Health reveals that 17 in every 100,000 men are diagnosed with prostate cancer, while 9 out of the same number test positive for esophageal cancer.
And then we have these cancers that are not age dependent. So things like esophageal are not gender dependent, sorry. So things like esophageal cancers, colorectal cancers, the cancers of the gastric cancers, cancers of the stomach, and things like that. You'll find that they'll be more common in men than in women. That is largely due to lifestyle.
Both doctors ascertain that breast cancer is commonly linked to genetics, but lifestyle continues to be a contributor to some of the common types.
Cancer of the cervix is actually transmitted by sexual interaction. You get a virus called the human papilloma virus, which has a high prevalence in our country. And anyone who engages in unprotected sex will get human papilloma virus. And suffice it to know that even the condoms don't protect you from getting human papilloma virus. The more sexual partners you have, the higher the risk that you will get cancer of the cervix.
As the country joins the international community in marking World Cancer Day, Kenya reflects on the strides made in alleviating cancer burden on her population.
A lot that has been done, and there's still room to do more because of the increase in burden in the incidence of cancer in the country, and the fact that it's the third leading most cause of death in the country. There's much more we can do.
Timothy Simwa, K24, Evening Edition.